My acne breakouts healed, but they left raised scars in their place. That's what we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute, and we're a dermatology practice specializing only in the treatment of acne. So we like to share certain insights and experiences that we have with acne sufferers who are navigating the path toward clear skin, and we hope you find this information useful from an educational standpoint. This is not medical advice. So today we're going to talk about a type of scar that occurs after an acne breakout that is raised above the surface of the skin. So there are scars that we call keloid scars or hypertrophic scars. These are both types of scars that raise up. That means when an acne breakout heals, the healing process gets overdone and it keeps healing. Even when it's already healed, it keeps going and it builds this mound of skin that is raised above the normal level. So this is a very common problem that we encounter in some patients who are susceptible to scarring from their acne breakouts. And it's a bother. Sometimes they're itchy, sometimes they're painful, sometimes they just don't like them from a cosmetic standpoint, and they want to treat them. And so for these types of scars, often the thing that we use for treatment is a small, tiny injection of a cortisone type medicine that we inject right into the scar, and it helps to flatten the scar down. Now, sometimes it takes more than one session. Sometimes the scars regrow and they need a repeat treatment in the future, but that's a treatment that we do fairly often when these types of scars arise. And remember, the most important thing is to prevent them from happening as much as possible, so that when we do have a case of acne, to try and get under treatment as soon as possible to prevent more scars from forming, because any type of scar is always a difficult thing to address. But for those types of scars, that is a typical treatment that we use to help to reduce the scar and try to bring it back down flat with the normal level of skin. And it's usually very effective, but as I said, oftentimes we have to do the treatment in a repeat session, or sometimes it can occur again later on and we have to do the treatment over again. But nevertheless, it is a treatment that we commonly do here at Advanced Acne Institute, and it is something that is fairly successful.